Welcome, everyone. I'm Nancy Litz. I'm the Vice President of Leadership for the National Council of Jewish Women, an organization that draws on Jewish values to advance social and economic justice and equity for all women, children, and families, and also a co-sponsor of this series. Therefore, your moderator for today. On behalf of all of our co-sponsors, and let me list them for you, the Jewish Community Relations Council, the Interfaith Partnership, the YWCA, the Merowitz Center at Covenant Place, the Peace and Justice Commission of the Archdiocese of St. Louis, and the nonprofit Before Ferguson, Beyond Ferguson. All of us together welcome you to this, the third in a four-part series about systemic racism in our region. Today, we're specifically focused on environmental racism. Quick logistics, we'll begin with a clergy perspective, then take a deeper dive into the topic with our keynote speaker. After that, we'll hear from an individual St. Louisan whose life has been impacted by this issue. Then we will provide you some additional learning resources as well as some action items that you can take about environmental racism. We'll leave some time for Q&A at the end, so if you have questions for any of our speakers, please go ahead and type them into the chat so that we can draw on them for that Q&A section. With that, I will pass the microphone over to the Director of Civic Engagement for the Jewish Community Relations Council, my friend, Alyssa Banford.
Hello, everyone. Good afternoon now. Nice to see you all. So for those of you who have joined us before, you know what time it is. For those who are new to our program, welcome. It's time for definitions. So before we dive into the program, we like to make sure that we're all using the same vocabulary. So to begin, we're going to name three types of racism: individual, cultural, and systemic. None of these are completely separate. They all work together to keep the status quo. So let's break them down. Individual racism refers to an individual's beliefs. These are attitudes and actions that perpetuate racism. Examples include telling racist jokes. It also includes collusion, the act of going along with or keeping the status quo, accepting things the way they are. You may be less familiar with a subcategory of individual racism. This refers to liberal racism. This refers to statements or actions of masked denial, minimization, defensiveness, or guilt. So someone claiming that they understand the pain of racism because they experience a different form of oppression, or saying that they are colorblind. Those are examples of liberal racism. Next is cultural racism. This refers to representations, messages, and stories conveying the idea that white behavior or values are better than others. You'll see cultural racism promoted in advertisements, TV shows, movies, etc. So let me give you some examples of that. What do bad guys wear? They wear black. What do good guys wear? They wear white. What is, devil's food cake? It's black. Angel food cake? It's white. You get the point. So not only does that perpetuate the idea of superiority, it also internalizes racism. Lastly, there's systemic racism, and that has the subcategories of structural and institutional. And these are often used interchangeably. An example of institutional racism can be found within government policies that explicitly restrict the ability of people to get loans to buy or improve their homes in neighborhoods with high concentrations of African Americans. This is also known as redlining. Structural racism is the normalization and legitimization of dynamics. An example is the huge difference in life expectancy between the Black population and the white population, which we heard about in last month's session. So then systemic racism as a whole is the distribution of resources, power, and opportunity, which disadvantages Black people and people of color. We find systematic racism in banks, schools, companies, government agencies, law enforcement, military, etc. What is a result of systemic racism? Well, lots of things, including disparities of wealth and income, employment, criminal justice charges, home ownership, levels of education, representation in politics, etc. Our topic today, environmental racism, is a direct result of systemic racism. However, the definition of environmental racism, coined by African-American civil rights leader Dr. Benjamin Chavez in 1982, is rife with terms that we've already heard. So it's, by his definition, environmental racism is racial discrimination in environmental policymaking, the enforcement of regulations and laws, the deliberate targeting of communities of color for toxic waste facilities, the official sanctioning of the life-threatening presence of poisons and pollutants in communities, and the history of excluding people of color from leadership in ecology movements. Okay, so under the surface of the singular sounding term environmental racism, there's an entire substructure of structural, institutional, systemic, cultural, and individual racism. That's a whole lot. There are a tremendous number of factors that go into how environmental conditions that disproportionately impact Black people and people of color. Now, okay, we don't have to go, we don't have time to go into each piece of the puzzle, but here are a few pieces that go into environmental racism. So you have flooding, lead poisoning, polluted water, proximity to plants and factories, toxic waste facilities at landfills, lack of green space, etc. Okay, so what are we striving for? Obviously, we want to eliminate racism, but it has to go further than that. Hopefully, you all know by now that we want equity rather than equality. What's the difference? Well, equality is giving everyone the exact same resources. Equity is the distribution of resources based on individual needs. It takes into account differing circumstances in order to reach an equal outcome. I know that's a lot of information, but we'll go over these in the next session as well. And you have the guide that we'll send out after this session too. Last thing before we jump into today's topic, community standards. Now, I'm not going to go into these today, but we are going to send these out for follow-up so that you can keep these in mind when you have future conversations. Just another great thing to keep in mind when we're having difficult conversations. Thank you all. Turning it back to you, Nancy.
Great. Thanks so much, Alyssa. As always, we'll start our session today with a faith perspective. Our guest is the pastor of the new Northside Missionary Baptist Church and himself a passionate advocate about environmental justice through the St. Louis Clean Air Advisory Commission. He's also part of literally too many coalitions of clergy in the area for me to even list for you. And now also the vice chair of the cabinet for the Interfaith Partnership of St. Louis. Besides all of that, he's the author of the book, The Moral State of Black America, and you can read his columns in various St. Louis publications. So help me welcome the distinguished Reverend Roderick Burton.
Thank you very much for that introduction, Nancy. You're very kind. So appreciate being invited to this forum. I'm very thankful for the National Council of Jewish Women as well as the JCRC in presenting these sometimes very uncomfortable but necessary and timely topics that are very informative. And so I really appreciate Alyssa for laying out some definitions, because oftentimes when we have these forums, we just make the assumption that everyone knows what we're all talking about, and we don't. And so we're very grateful for that, but also very grateful for those rules for engagement, community rules. I think they're very helpful. So without any further ado, I just want to share a few things uh, from the much of the roots of the Christian faith. And so, I'm speaking from that perspective. I had a seminary professor say that you don't go into an Italian restaurant and expect to order Chinese food. So let he who has ears, let him hear. So coming from the Christian perspective, uh, there's this idea of love your neighbor as thyself. But because of the sin of pride and the sin of pride in elevating one's group over other groups, that's how you have whole groups of people, African Americans, Native Americans, Asian Americans, trans people, LGBTQ. That's how you have people being in positions of being discriminated against, victimized. And in our case, we're talking about environmental racism. And so whole communities or whole sections, if you just read the history of East St. Louis or history of, and you think about where Brentwood is, Galleria, how communities were removed because they were seen as less than, or where communities of color are placed. And more recently, we've all heard in the paper about the illegal dumping of tires. And so from a position of I have pride that I feel that I'm better than you, that I am of more value, when Christian texts, Jewish texts, Islamic texts, and texts of many faiths say that humanity, or as we would say in Christianity, we're all created in God's eyes. We're all of equal value. But the problem with humanity is of pride, one elevates himself above other people. Or, we may say in the Constitution, all men are created equal, but the reality is some folks are more equal than others. And so from that situation, you have communities such as African American community that has higher rates of asthma, higher rates of a number of ailments that you can tie to the environment. But here's the problem about allowing for environmental racism. Allowing for one community's water or air or land to be polluted, that doesn't stay in one place. Every human being needs water. Every human being needs clean air. And so to allow one particular area for it to be toxic, that does not stay in that particular area. And so we can look at what's going on with the Westlake landfill. If you drive up 270, you can remember the smell. The smell was not just harming people of color or poor people. That smell was harming everyone. The toxic waste polluting the water is not just harming people of color, that's harming everyone. So it's necessary to take environmental racism seriously, because it's not only affecting the victim who it's been allowed to affect, but also the victimizer. So some of the things that we try to do, and I'll try to wrap this up, is one of the things that we try to do is oftentimes African Americans are so busy pushing back and fighting standard issue racism. Sometimes there's not a language or understanding that there's also this realm of environmental racism. And so some of the work that we've been blessed to be part on, the Clean Air Commission in St. Louis, is as we think about a future with cleaner energy, a future that's different than the energy that's being used now, if there's not intentionality in that question of bringing equity into it, you can bring a whole new green energy, but it still be as exclusive as the old energy sector. But again, the idea is to love your neighbor as yourself. And so I hope that perspective was helpful. I'm so grateful for all of y'all being on here today. I thank you for this forum, and thank you for inviting me.
Thank you so much, Reverend Burton. It was an absolute pleasure to see you and to have you join us. Next, we'll dive into more nitty-gritty on this issue with our keynote speaker. She's an assistant professor of practice at the Washington University Law School and the assistant director of their pro bono interdisciplinary environmental clinic. Students in the clinic program represent nonprofit agencies and under-resourced communities tackling some of the most challenging water, air quality, waste, climate change, and environmental justice problems in the entire region. She oversaw the clinic's 2019 report, Environmental Racism in St. Louis, a report that was prepared by the students on behalf of the Sierra Club, Action St. Louis, the Arch City Defenders, and the Dutchtown South Community Corporation. A bit more background, her decade of litigation practice included efforts to hold a mining and smelting company responsible for the lead poisoning that its operations created. She also clerked for Judge Stephen Limbaugh of the U.S. District Court, and she worked on opioid litigation for the Office of the Missouri Attorney General's Office. So to outline the history and the impact of environmental racism in St. Louis, please help me welcome Professor Tara Roque. Professor Roque, it's all yours.
Thanks. Just Tara works for me. Let's share my screen here. Here we go. Well, thank you very much for that warm welcome. And I'm always nervous to follow speakers like Reverend Roderick Burton, who does such a fabulous job. So you already got a good explanation of what environmental justice is from Alyssa. I'm going to quote Robert Bullard, who's known as the father of environmental justice. Environmental justice embraces the principle that all people and communities have a right to equal protection and equal enforcement of environmental laws and regulations. Environmental justice will be achieved when 1, we all receive equal protection from environmental harms, regardless of race, color, or national origin, and 2, people's voices on the placement of pollution sources are viewed with equal importance, again, regardless of race, color, or national origin. St. Louis as a city is far, very far from meeting these goals. As detailed in the report released by our clinic, Environmental Racism in St. Louis, our city is a classic example of environmental racism. Environmental racism is the converse of environmental justice in that it reflects the fact that many environmental hazards disproportionately affect people of color. Now, I want you to note that while I'm only going to talk about St. Louis today, these problems are pervasive throughout the country and frankly throughout the world. St. Louis, unfortunately, is a particular hotbed, but we are not unique. These are problems that need to be addressed throughout our region and throughout our country. Now, the report that the clinic put together is somewhat unique. Instead, unlike former reports that looked at individual issues affecting Black St. Louisans, whether it's food deserts, air pollution, lead exposure, we examined how several environmental justice indicators are interrelated, how they cause each other and exacerbate each other. Now, I know this slide looks like a big mess and it's hard to understand. I'm going to show it to you again later in the presentation when I think you will understand it better. But for now, just start with the general idea that the issues I address today, which are lead exposure, asthma, mold, air pollution, home energy burdens, food deserts, vacancy, and illegal dumping, are self-perpetuating problems, interrelated self-perpetuating problems that significantly affect and disparately harm Black St. Louisans. The results of these collective harms are awful and simple: decreased health, increased poverty, and decreased quality of life. The first issue I want to talk about is lead exposure. Children are at most risk of harm for lead poisoning. Now, there is no safe level of lead exposure. Lead exposure in children is bad. It can result in permanent brain damage, permanent reductions in IQ, permanent behavioral issues, and permanent increases in levels of aggression. Now, this does not happen to all children, but there is a significant link between one and the other. Children who are exposed to lead as children are more likely to drop out of school, are more likely to engage in criminal activity, and are more likely to engage in or be victim to violence, particularly domestic violence. There are a number of ways that our children are exposed to lead, but one of the most common levels of methods of exposure is lead-based paint and dust. Lead-based paint was banned in 1978. Approximately 90% of the city's homes were built before then. Therefore, approximately 90% of homes likely contain lead paint. However, lead poisoning rates are not equal between Black and white children. Black children are 2.4 times more likely to test positive for lead, and 70% of children suffering from lead poisoning in our city are Black. People living below the poverty level are at greatest risk, and that is because those neighborhoods are more likely to contain ill-kept housing stock and rental housing. That are the most common vectors of lead-based paint in our region. Asthma is another major environmental justice indicator. Asthma is commonly triggered and worsened by air pollution and exposure to allergens like mold, two issues that I'm going to discuss in a minute. Not surprisingly, St. Louis is one of the worst cities in the country for asthma, but this does not affect all St. Louisans equally. Black St. Louisans made 8.5 times more ER visits for asthma than white St. Louisans. When you look at children, the disparities are even greater. Black children are 10.8 times more likely to end up in the ER each year for asthma when compared to white children. If you break that down to the numbers, for every 1,000 Black children, over 42 of them will end up in the ER for asthma each year. For white children, that number is less than 4. Now, the disparity is made worse by St. Louis's already extremely high asthma rates. For Missouri residents overall, approximately 5 of them will end up in the ER each year for asthma. Compare that to Black St. Louis City residents, and the number is over 24. And again, for Black children, over 42 each year, compared to about 5 Missouri residents. Making matters worse, Black St. Louisans are statistically more likely to lack adequate medical care. And many of the public schools in majority Black neighborhoods in the city lack full-time school nurses, practically ensuring that children's asthma will not be properly controlled. Mold. Now, this picture right here, this picture was taken by our clinic in someone's house in the city of St. Louis. This is how people live in our city. Mold causes a variety of illnesses and it can trigger asthma attacks. If you remember, I said these issues are all interrelated. Mold, like lead, is a problem endemic to old, ill-kept housing stock. Properties that are improperly sealed from the elements or containing water leaks are more prone to develop mold, again, low income and landlord-owned properties. Mold complaints are more significant in majority Black neighborhoods, but unfortunately there is no legal standard for mold exposure, none whatsoever. So landlords cannot be legally required to fix it without extensive litigation under wishy-washy habitability laws. That means a housing inspector can walk into a home, see an entire wall covered with black lead, and cannot do squat about it. The majority of St. Louisans live in rental housing, and over 1/5 of the city lives below the poverty line. So many people are affected by this, yet they have little or no practical recourse. Air pollution. Air pollution has significant negative effects on our health. Not only does it worsen asthma, but it damages lungs, it contributes to premature death, and is linked to cardiovascular problems and adverse birth outcomes. So I'm not talking about little concerns here. Air pollution significantly damages all of our health. Now today I'm going to focus primarily on two types of air pollution, ozone pollution and fine particle pollution. Now ozone, as we all know, is that layer that we all love because it keeps in our atmosphere and keeps out the vacuum of space. We like ozone, but we like it up there. It's not supposed to be down here where we're walking around and breathing. Ozone pollution occurs when pollutants from vehicles, power plants, and the like chemically react in the presence of sunlight and is the primary component of smog. St. Louis has been in violation of federal standards for ozone pollution since 1979, 42 years. The other pollution I'm talking about, fine particle pollution, is particulate matter 2.5 microns or smaller, significantly smaller than the width of a human hair. That means that when we breathe it in, it works its way very deep into our lungs and can cause significant long-term damage. Particulate matter comes from dust, metals, mold, pollen, vehicle emissions, and the like. It can include sulfur dioxide and nitrogen oxide. St. Louis was in violation of federal standards from 2005 to 2017. While we are now in compliance, it's still not good. The majority of air pollution sources, which are the blue dots on this map here, are located in majority Black neighborhoods. Many areas bordering highways are also in majority Black neighborhoods, and the majority of demolitions, a serious source of fine particulate matter, are also in majority Black neighborhoods. Now, the reason why this map here that I'm showing focuses on air pollution sources as opposed to actual air pollution levels is because St. Louis doesn't really track it. We have only 4 air pollution monitors in the entire city, and 2 of them are located across the highway from each other. We don't know what the air pollution levels are like and what we are being exposed to in the majority areas of our city, and particularly all of North St. Louis, where most of those black dots are. We have no clue what's in the air up there. Home energy burden. Home energy burden, some of you may not know what that is. It's defined on the percentage of household income spent on utilities. Of the 48 major cities in the United States, St. Louis places the 6th highest energy burden on Black households. As you can see from this graph, Black households have nearly twice the home energy costs than the average St. Louis household. People who are Black and Latino, renters, or low-income individuals statistically have higher home energy costs per square foot than white residents and those who own their own homes. Home energy burdens are more common in rental housing because there is an incentive vacuum. Tenants usually pay the utility costs. Therefore, landlords have no incentive to make the capital expenditures to insulate the homes, seal leaks, or replace old and inefficient appliances. And you may think that spending more on energy costs is not that big of a deal, but I'm not talking about small increases. In writing our report, we spoke to a woman who could not use her furnace because she could not afford to and had to heat her house in the winter by running her stove and leaving it open. Another woman who rented an apartment for $700 a month was paying another $700 a month just to use her air conditioning and heating. That is not a tenable situation.
Could you repeat the 6th highest in the nation? What was that statistic?
It's of the 48 major cities in the US, we place the 6th highest burden on Black households. I forgot to do that one, sorry. But in addition to the financial burden, it does more than just harm people in their pocketbooks, although that is a big problem. Houses with old appliances and unsealed leaks are more prone to mold infestations, which then increases asthma rates and respiratory illnesses. In addition, excess energy usage due to unsealed leaks and inefficient appliances serves to increase the air pollution, increasing asthma and what have you. So like I said, this is circular and the issues are interrelated. Food apartheid, otherwise known as food deserts, is another major issue plaguing our city. This slide over here shows whether people are half a mile or a mile from grocery stores, and the black dots show which areas are majority Black neighborhoods. Now, you may think that half a mile to a grocery store doesn't sound like a big deal. But in St. Louis, and particularly in North St. Louis and in majority Black neighborhoods, those neighborhoods, which are our food deserts, are statistically, the people living there are statistically less likely to have access to cars, and public transportation in North St. Louis is notoriously bad. So you think about trying to carry your groceries for a family of 4 for over a mile when you don't have access to a bus and you don't have access to a car. That is nearly impossible. Black St. Louisans are almost 2 times more likely to have limited access to healthy food than white St. Louisans, 11.9% versus 6.3%. I already went over the causes, and a lack of access to healthy foods leads to obesity and other diet-related illnesses. Not coincidentally, Black St. Louisans have statistically higher rates of obesity and diabetes than their white counterparts. As stated by a food justice organizer with whom we work, the whole system is jacked up and inconvenient. Vacancy. Now, this is a picture taken in St. Louis. This is a street in our city. This is a mother and her child walking in St. Louis. I borrowed this from St. Louis Post-Dispatch with permission. St. Louis suffers from something called hyper-vacancy, meaning that we have incredible rates of vacancy. We're one of the worst cities for vacancy in the nation. Approximately 90% of these vacant properties are located in majority Black neighborhoods. In many of the city's census tracts, about 40% of them, over 10% of the properties are vacant. 10% of the properties are vacant. And 25% of all vacant properties in the city can be found in just 3 neighborhoods, 3 majority Black neighborhoods: Wells Goodfellow, Jeff Vanderloo, and Greaterville. This map up here, for each one of those red dots, represents a vacant property or lot. As you can see in North St. Louis and some areas of South St. Louis, the vacancy problem is absolutely out of control. And frankly, the reasons for this is obvious. While the city has invested significant amounts of funding in its central corridor, Wash U, Central West End, Midtown, downtown, majority white neighborhoods, it has not done the same in majority Black neighborhoods. And frankly, it has completely forgotten about North St. Louis. Vacancy affects communities financially and mentally. It reduces property values of surrounding homes, and it demoralizes neighborhoods. It also poses significant health dangers in that abandoned buildings may contain asbestos, lead, and other chemical substances that then get out into the air we breathe as those houses deteriorate. It opens the elements, so it grows mold. There are often demolitions, which then increases air pollution. And they are havens for criminal activity, whether it's squatters, drug users, or what have you. And it is a self-perpetuating problem. As vacancy increases, more people leave if they have the financial ability and the wherewithal to do so, and less people move in. And then more people leave and less people move in, and it ends in a never-ending downward spiral. Illegal dumping. Again, this is a picture taken in an alley in our city, not in a majority white area, and certainly not in the Central West End or Clayton. Illegal dumping is a consequence of high vacancy. Deteriorating buildings and vacant lots practically invite illegal dumping. Now, I'm not talking about people throwing a soda can out their window or not putting their trash bag out in the dumpster. Dumped items most commonly include construction waste, demolition waste, and tires sent for recycling, often dumped by the truckload in our streets, in our alleys, and even in people's yards. To put a number to this, in 2017, over 22,000 tons of trash were illegally dumped in the city's streets and alleys. And that number is an undercount because the city doesn't count the trash that's dumped in lots. 22,000 tons in 1 year in the streets and alleys. By comparison, only 9,000 tons of trash were properly disposed of in the city's transfer stations. more than double. Illegal dumping like vacancy, oh, of course, I don't know if it needs saying, but most commonly dumping occurs in majority Black neighborhoods. And illegal dumping like vacancy is a self-perpetuating problem. When people illegally dump in dumpsters, you think, oh, it's okay, I'm putting it in a dumpster. But no, it reduces the capacity for the folks that live in that neighborhood. So they're forced to leave their trash in the streets and alleys. Trash dumped in a neighborhood emboldens other bad actors to then take their trash there. They think, oh, if people don't care about this neighborhood, why should I pay to dispose of my trash? I'll just put it here. And in addition, it reduces neighborhood morale and reduces property values, which then increases vacancy rates, which then invites more illegal dumping, which then increases vacancy rates, and so on and so on and so on. And it is also a significant danger to health. Since we're not talking about trash, we're talking about construction waste and tires that have full of oil and full of chemicals and asbestos and lead and rusty nails and rebar and all sorts of things that should not be in our streets, in our yards, and in our alleys. And it attracts vermin, it attracts insects, and frankly, it's just disgusting. So I've gone over, quite frankly, a parade of awfulness. I want to give a quick summary just to see everything that's going on here. Black children are 2.4 times more likely to test positive for lead compared to white children and account for over 70% of all children suffering from lead poisoning. Black children make 10 times more ER visits for asthma when compared to white children. The majority of air pollution sources and building demolitions are in communities of color. Mold complaints are more common in majority Black neighborhoods. The energy burden for Black households far exceed the citywide median and that of white households. Black St. Louis residents are almost twice as likely to have limited access to healthy foods. The majority of illegal dumping occurs in majority Black neighborhoods, and more than 90% of vacant properties are found in majority Black neighborhoods. All of these factors come together to disparately harm one subset of our community, Black St. Louis residents. And this is not okay. So that brings us back to this amazing mess. And now you may understand how we got here. This was actually a thought experiment that my students put together when they were trying to unravel all of these factors so they could examine them separately to figure out how to attack these problems. And then they realized you can't attack them separately, because they are all interrelated. And it comes down to having clean air, to having safe housing. Really, that's what we need. We need clean air and we need safe housing. I mean, there are some issues that need their own specific ways to address, like vacancy and illegal dumping. They're their own little mess that need to be attacked. Well, big mess, I should say, that need to be attacked. But really, we need to come together to make our city safe, to live in, to breathe, to drink the water, to live in our neighborhoods for all of us. So that leads us to, and I'm a little over time, what can we do? And the answer is, oh, so much. Would it be okay if I spent just 2 more minutes talking about this? Thank you.
Sure.
So at the federal level, and there's so much more than this. This is all I could fit on a slide. At the federal level, a recent bill introduced by Cori Bush called the Environmental Justice Mapping and Data Collection Act is one near and dear to my heart because it was a bill that's partially inspired by the work that our clinic did. And it seeks to take the data analysis that we did, but move it to a federal level and do a census block by census block analysis of the environmental hazards, and also including gun violence and other factors that affect our communities, to figure out exactly what is harming people, how much are they being harmed, and where. And then to use that data to direct 40% of the country's climate ready spending, to ensure that that money isn't snatched up by special interests, but instead goes to those who need it and who are actually harmed. But also at the federal level, we need to increase funding and grants for environmental justice initiatives and improve legislation and regulation to promote renewable energy, clean air, and clean water. At the state level, we need more air monitors. monitors. We need more air monitors. We cannot know how to address these problems until we know what they are. We need to expand Missouri's Medicaid program so that people have access to quality medical care, aren't going to the ER as their primary care physician. So there's continuity of care. So these issues like lead exposure, mold, asthma can be caught and tracked by a single physician who knows how to treat that patient. We need to improve the landlord-tenant laws so tenants have the power to advocate for themselves without risking the roof over their heads and their credit. We need to increase public funding for lead and mold abatement, and we need to promote renewable energy. And at the local level, we need to improve city data and collection efforts so we can better tackle these problems. Improve the occupancy and building codes so that the houses are more energy efficient and so that mold is an occupancy code violation. Targeted code enforcement for vacant properties. Improve and increase green spaces so they are not only in the white areas of this city. North St. Louis needs beautiful green spaces and quality green spaces. Improve public transportation, promote urban agriculture, provide tax incentives for grocery stores or promote community-owned grocery stores. Heightened policing and prosecution of illegal dumping, but targeted policing. So this policing does not further harm to over-police Black communities. And erect barriers in area prone to illegal dumping so it's not easy because it's a crime of convenience. Really, there is so much more, but sorry, I get worked up about this because environmental racism harms our community. It is harming our children. It is harming our future. And until we tackle these issues, we cannot move forward as a city and we cannot grow as a city. Thank you. Sorry, I need to figure out how to end screen sharing. I can't do it. Here we go. Thank you.
Thank you so much, Tara. Obviously, I'm sure you have gotten many of us also worked up about this issue. And that's not the end of the story. In addition to wanting to bring you the nitty-gritty about this issue, it's also so important to share at least one of the individual faces behind this massive problem. And to do that, I first want to introduce you to Zach Bailey. Zach is a Clayton High School graduate. It is, after all, St. Louis, so we need to include that detail. And currently a student at Columbia University and also a reporter for the Before Ferguson, Beyond Ferguson project, which works to share the individual stories of people who are dealing with the issues of systemic racism here in St. Louis. Zach is working toward a degree in education with a specific focus on helping to close the achievement gap and help disadvantaged students succeed in high school and in college. And I'll turn it over to Zach to introduce our next speaker.
Thank you so much for that really kind introduction. Thank you to Reverend Roderick Burton too for your comments, and Professor Roque. All of these ideas are really important. It's been a really big honor getting to know Ebony Smith-Thomas and her mother, Debbie. And so I'll start off by just starting our kind of interview portion. So Ebony, I know you were only a toddler basically when you began your struggle with lead poisoning. And that is also why your mom, Debbie, has been so important to our interview process and learning more about what you've been through. So Ebony, you and your mom have told us that you got lead poisoning from eating paint chips in the apartment where you were staying on the campus of St. Louis University. Tell us about your family situation at that time.
Zach, that is correct. but I was only 2 years old then. This is what I learned when I got older, when I was going to starting school as a kindergartner, the effects of having lead poison. We were living in St. Louis University housing because my mother was attending college there to become a paralegal. I always loved to go outside, so I would look out the window a lot. And while looking out the window, I was eating paint chips because lead paint is sweet, knowing that I was to be eating them. But as a toddler who snuck behind my parents' back, eating things that I wasn't supposed to be eating. So unfortunately, being a toddler, I didn't know the ripple effects that it would have on myself and my family.
Right, who could? In many ways, St. Louis University, the medical school especially, who you and your mother interacted with pretty extensively, had for years been at the forefront in addressing lead poisoning in the city. But what happened when you, Debbie, brought your situation to the attention of the university, even beyond just the medical professional, any administrative officials or housing officials?
The housing officials just turned a blind eye and mouth sewn shut. And the city health department weren't forthcoming, and I made several complaints for them to come out and do testing, and they never showed up. And my pediatrician, her pediatrician taught me like I was a newborn mother with too many worries and concerns. I had to let her know this is my third child. And they could never come up with a diagnosis until I found out about lead testing that was going on in the daycare that my middle child was going to. They didn't know when it was going to happen, and they sent me to the St. Louis City Department of Health. And I had to like reinvent the wheel because nobody was helping me. Everybody knew nothing or just didn't say anything. So I demanded that her pediatrician test her blood for lead poisoning. And when the results came back, it was so high that they immediately sent us for admittance to Cardinal Glennon to have some of the lead removed. The doctors there said that they couldn't remove it all, and the prognosis was that she would not be able to go to regular structured classes. She would have to go to special ed. And so what I did, I knew kids learn by repetition. So I rented a computer from Rent-A-Center because I couldn't afford to buy one. And I made programs for her homework and the homework that I gave her that were repetitions, songs, games. And I also went every year to meet the new teachers and throughout the year and never let them let her use her lead poisoning as a crutch. And I also had them put her on the front row so that she couldn't be in the kids playing back behind her.
Yeah, it sounds like.
Also, I found out that St. Louis University spearheaded this in 1971, and this was 14 years after Ebony was diagnosed. And the housing staff and St. Louis City built a lead department in that health department, and this was 13 years after she was diagnosed. Yet nobody knew nothing. Nobody tried to work with me or anything, and I just had to just keep advocating for her.
Yeah, it's interesting because I study education, and in my conversations with Ebony, your passion for education, Dr. Debbie Smith Thomas, Dr. Webby, was pervasive. So especially because I think it's interesting because you had to go through a daycare center too. So the educational process, institutions have been a part of this issue and continue to be. Actually, in 2016, a number of water fountains at St. Louis Public Schools actually had to be taken out and removed because the water coming out of them, the water that St. Louis Public School students had been drinking for years, was not safe. And they just removed the drinking fountains in 2016. So
To
Ebony,
piggyback off of that real quick,
yeah.
Zach, what's ironic is that the Coronado that's right there on Lindell and Spring is where we stayed. And I got diagnosed in 1985 and they closed down in 1986. And they didn't open back up, I believe, until 2002 when somebody else took over the building.
So this article is kind of like what my mother used to say, every shut eye ain't sleeping, every goodbye ain't gone. So now it's being brought to the forefront. Because back then I didn't know about environmental injustice. You know, I knew about structural and institutional injustice, and I didn't even know back there that, you know, there was racism in with how Black people were treated in the medical field with their doctors. I just thought it was me. She thought I was a new mom and was just worrying too much, but she just kept ignoring me, and I just had to tell her. She kept saying nothing was wrong, and I just told her every time she says her fingers hurt, I'm coming back. And I did that, and it got to the point where she told her nursing staff anytime I called to let me come in, instead of saying I had to wait, because that's how hard I fought.
Right, and that is a hard thing to do too. I'm not sure if a doctor told me I was fine, if I would keep coming back, honestly. It's a hard thing to commit to. And speaking of medical care, you are now dealing with an illness called PPCM that you are also fighting to raise awareness about for nearly 5 years. Do you mind explaining a little bit about what that is and what has that been like? What has that been like for you as a mother with 2 boys?
And my nieces, don't forget
And your
them.
nieces, your babies.
Life has been a roller coaster, to say the least. It's been mentally, emotionally, and beyond extremely a financial burden. You know, I worked so hard, you know, throughout school, as an adolescent up until being an adult. And the whole thing of saying that I would never be able to attend a structured school or to be able to graduate college, that was my motivation to show that I'm not what somebody say that I'm going to be. And of course, I proved them wrong, but going back to the whole PPCM, I worked so hard to get my degrees, to have good credit, to have a career, and it all suddenly changed because I never wanted to be on government assistance. And unfortunately, on May 16th of 2016, my life came to a screeching halt. And that I wasn't prepared for at all. I never heard of PPCM, and that is where you go into heart failure in the last trimester or up to 6 months after pregnancy. And it was again my mom who came in and saved me because I was at home and our AC went out, and we stayed in a townhouse on an upper level. So we all came over to her house. And when I woke up the next day, she was like, Ebony, you know, you were up all night. And I'm like, Mom, what are you saying about breastfeeding? She was like, no, you had a dry cough, and the way you were coughing, something should have been coming up. And there's a such thing as walking pneumonia. So you need to go to urgent care or the emergency room. And it was Memorial Day. I'm like, you think urgent care open on Memorial Day? She was like, the ER is always open. So I went. What they found out at urgent care, they thought it was pneumonia. Well, they said they couldn't do nothing for me at urgent care. So I had to get transferred down to BJC. The young lady walked in with an ultrasound monitor, and I'm looking at her. I said, "Ma'am, I'm not pregnant. I just had a baby." She said, "No, this is for your heart." And I'm like, "My heart?" She said, "Yes, your heart." She said, "Look at the monitor. The way that your heart is beating, you have a decreased squeeze and you have a lot of fluid overflow. If you wouldn't have came in, your heart was going to eventually stop pumping." So, but I'm always appreciative and grateful that God has stood on his promises and hasn't left me. I got my transplant on August the 19th, 20, and that was the biggest blessing ever that I probably could say in my life, because I knew that eventually that my native heart, when I went in on July 27th into the hospital, I think my heart function, if I could remember, was at 5%. So from May of 2016 all the way up until August of 20, I have been dealing with so many different health issues, hospital visits, just over and over again. I got the transplant, and then once I got the transplant, they saw in my new heart that a lethal blood clot was growing rapidly. So 20 days apart from the transplant, I had to get a second open heart surgery. And it was successful, but it has caused a lot of issues that I'm dealing with right now. But again, I'm grateful, I'm appreciative, I'm still in the land of the living. And the joy that I get out of my children's and just anyone, I have a joy for helping others. Like, I want to see people succeed in life and just live a happy life. And I just try with my children to make sure that I give them individual QT time. I make sure that I give them, we all do stuff as a family, and that's just really what I want to do. I want to see people that are in my inner circle succeed.
Right. No, and especially because you mentioned your boys, Clayton and Kamari, your nieces. What has been especially hard, it seems, about this time too, is that you have to be very careful about your contact with other people, even your kids, when you're talking about working so hard but still needing government assistance, being on unemployment. I think millions of Americans, especially Black American, are dealing with this during COVID. And you are much more at risk of dying from COVID. And so did you want to say a little bit more about what that's been like during COVID in particular, since we're all on Zoom because of this pandemic?
Well, when the pandemic happened, the first thing my team called me and was like, "Clayton needs to be taken out of school because he, little kids his age, germs." And so, and at that time, I had the Millerone bag that went straight, giving medicine to me straight into my heart. And they said he has to be, taken out of school. And I had already taken him out a week before that happened, because me and my mom knew back in, what was it, November, October already, of what was going on, and we knew like what was going to come behind that.
And you were wearing a mask.
Yes, and I was wearing a mask. Yes, I was wearing a mask since October of 2019. So it wasn't a big deal for me about wearing a mask. But what changed, because it was the winter time when I got my store wearing a mask, and the summertime it was getting really hard breathing in the mask, like having appointments or just sitting in the car or taking Clay to the park. But it wasn't really bad for us because, like I said, I love family time. And I have to say that that year I did not go into the hospital at all. I was going back and forth into the hospital, but once I came to my mom's house, I hadn't been in the hospital until the team called me in for my right calf, and that's when they kept me in July or whatever. So
Hey,
Zach and Ebony,
yeah.
this is Cheryl. I'm one of the organizers, and your story is amazing, and we're so grateful for you to sharing it, but we are running over and people aren't going to have a chance to ask you questions. One of the things, I want to say two things just to make sure everyone has full information. Earlier today and then later today, we sent out a link to a story about Ebony. And one of the important things that I don't know that we've connected is that it's very possible that her lead poisoning as a child increased her risk for this very rare heart condition that she has. And so we're sending you a link to that information. And there was something else I wanted to say, but I don't remember what. So thank you, and just stay put. We're going to do the next short section of our program, and then we're going to go to question and answers. So Nancy, I'm going to turn it back over to you. And thank you much. Just please hold on for a second for a few Q&A.
Thanks, Cheryl. And again, thank you so much, Ebony, for sharing your personal story so much to help us understand the real impact of these environmental issues. I'm sure everyone on the call at this point is having that, but what can we do moment. Tara gave us some good suggestions, and we'll share those back out with all of you, I'm sure. But I want to turn it over quickly to my NCJW colleague, Amy Hammerman, for some additional specific action items to get us started.
Thanks, Nancy. As you heard from Professor Roque, there's so much to be done at the federal, state, and local levels to address environmental racism. So we're going to suggest several actions you can take to encourage our policymakers to take concrete steps to address this issue. At the state level, we need to demand that the Department of Natural Resources increases its air quality monitoring in the St. Louis region. As Professor Roque noted, there are only 4 active monitors in all of the city of St. Louis. And as we know, people of color are more impacted by poor air quality and have a higher incidence of asthma. At the local level, we need to contact Mayor-elect Tashara Jones and Board of Aldermen President Lewis Reed and tell them we want them to revise building codes, increase code enforcement, and to prioritize federal stimulus money to eliminate food deserts and to enhance and create more green space in communities of color. We're going to be making these actions very easy for you. In our follow-up email, there will be a link to a Google form, and you can review the letter that has been written, and if you agree, you can sign on to the letter. And then we'll be sending the letter with all of the signatures and also notify the media that these requests have been made. So just imagine the power of receiving a letter with 250 or more signatures. So we hope you'll join us in taking these actions.
Thanks, Amy. And group, for one more action item, Adrian Bracy, who's the executive director at the YWCA, is going to tell you a little bit about the 21-day Racial Equity and Social Justice Challenge that our 2 groups are co-sponsoring. So Adrian, it's all yours.
Thank you, Nancy. So good afternoon to everyone, and I hope everyone enjoyed presentations today. It is such a privilege to collaborate and be a partner of this great series that's been happening for the past few weeks, months actually, a couple of months now. I wanted to share with you very briefly the 21-day challenge. It's the Racial Equity and Social Justice Challenge from April 22nd, which starts next Thursday. And we're very proud to have our partner JCRC and the YWCA Alton help with the participation. And we're hoping that you or the audience will be able to share this information. And I'm sure Alyssa will send out a link to this after today. But the 21-day challenge is a national YWCA initiative. It's being done around the country, other YWCAs, and grateful that Cheryl from JCRC reached out to me to collaborate. The 21-day challenge will ask participants to make daily time and space to build more effective social justice habits for 21 days. Each week, you'll have a different topic. The first week, which is starting next Thursday, the value gap, then the systemic racism and voting laws, the racial gap, wealth gap, disparities in healthcare and mental wellness, and then disparities in education. Our keynote speaker to kick off the 21-day challenge, which is next Thursday, is Dr. Carla Scott. Dr. Scott is a professor at St. Louis University, and she will speak, as well as one of the YWCA's Asian American employees will also give a 5-minute speech about, or just a talk about her experience with racism, especially here in St. Louis. And again, we hope that you will all join. You'll have the link, and we hope that you will be able to spread this word. We want to have at least 500 participants join us in this 21-day challenge. Again, it's just every day you will receive a task to do, and it's individual and it's honor system. So again, it's not going to be a lot of work for you, but we really hope that you will join us in this and share and spread the word. Thank you so much, Nancy.
Thank you so much, Adrian. I can say that I have already signed up for the 21-day challenge and am incredibly excited about it, and have passed that word along to the members of other organizations that I'm part of. I hope the rest of you will do the same, because it seems like as much as some of us already have been working on these issues, there's always more to know and more to understand. Cheryl, I need to reach out to you and ask, given the timing, how you would like for us to approach the Q&A.
So we are well over time. For those of you who want to stay, we will do about 10 minutes of Q&A, and we will not do our very final thing, which is to go into breakout rooms, because we want to respect people's times. But I think people have been so interested in hearing all of this. We did not want to cut anything off. So there are several questions that have been asked. I don't know, are you tracking them, Nancy, or did?
I've been making some notes, and, and by all means, feel free to jump in as well.
All right, go ahead.
Q&A, let me remind everyone that our next program will be at noon on May 12th, and that program will focus on addressing systemic racism within our court system, both here in St. Louis and beyond. So we hope that you will be back with us for that session as well. Now, turning to questions in the chat. Someone asked, and I didn't note who asked what, but one of the questions was, what is it that keeps this utility cost burden in place, and what kinds of actions could move the needle in the opposite direction? Tara, do you have some thoughts on that?
Sure. Well, the utility cost burden comes from, there are two main facets to it. In St. Louis, there is an income inequality. There's a racial income inequality where statistically Black people make less than white people in St. Louis. So you start from that base, where Black St. Louis residents have less money to spend because of systemic racism, frankly. You then have the other side of it, which is the quality of housing. So Black St. Louis residents are more likely to live in rental housing than white residents. And low-income individuals are also more likely to live in rental housing than those that have more money. And there is that incentive gap that I discussed in my talk, where to fix the issues that you need to reduce energy costs, you need to replace appliances, you need to seal leaks, you need to insulate. All of these are capital costs. They are capital costs that will not allow a landlord to increase rents, because these are things that should be done anyway. So they won't help the landlord, but the tenant pays the utilities. So there just is an incentive gap where tenants can't afford to make these capital expenditures. Landlords have no incentive to make them. And the end result is that tenants pay too much for energy.
So another question and a theme that was asked about repeatedly was that we have a new sheriff in town, so to speak, with Mayor Jones. What sorts of policies does she have either the power to directly enact, or obviously the bully pulpit to motivate the other entities within city government, and of course county government as well, because there's only an imaginary line around the city. What actions can she potentially take to start to ameliorate the situation?
Budget decisions. And I agree, these issues are also in St. Louis County, but we just needed a line for our report to where to stop.
Sure.
And since the organizations that we worked with were in the city, we looked at the city. But yes, North County suffers from many of these same issues. There is no difference with that respect. But yes, budgetary decisions. Right now, I don't have the exact number at my fingertips, but I believe approximately 50%, if not over 50% of the city's budget goes towards policing. Maybe take some of that money and move it towards health services, infrastructure, green spaces. There are all sorts of different ways that that money can be spent. Right, that is her biggest power right now is in budgeting decisions. A lot of the changes, frankly, have to be made at the legislative level, the state legislature, and through the Board of Aldermen. But the mayor does have significant power and does have a bully pulpit. There is much that she can do, but her biggest bully pulpit is the budget.
So with any audience made up of advocates on whatever issue, there's always this tricky balance between the service element of volunteerism meeting these needs and the policy work. And someone asked what about your thoughts about how much various volunteer efforts, Clean Sweep was brought up as one example. How much can these volunteer efforts make a difference, and what alternatives are there?
Organizations like Clean Sweep are fantastic, but they come in and then they leave, and then the illegal dumpers come back. So it's a temporary respite from the problem. Things like Clean Sweep need to be followed up by concrete action in order to prevent the dumping from reoccurring in the future. And this is a tricky situation, because you need to catch illegal dumpers, you need to increase policing and increase prosecution, but you're also doing this in communities that are already over-policed and over-prosecuted. So this is not an area where I feel comfortable recommending what needs to be done. In fact, instead, I think I would prefer going into the communities that are harmed by illegal dumping and asking them what needs to be done, because this communities that are suffering from excess illegal dumping are also suffering from this excess policing. And I, as a white woman, don't feel comfortable saying what needs to be done there. I would prefer to listen. I was planning on having events where I could try to learn these things, but then COVID happened and I was no longer able to have in-person events. So I am at a place where I'm not comfortable saying what needs to be done, because I haven't heard from the community what they want. And it really is their decisions and their wants and their needs that need to be addressed, not what I think, because I don't have illegal dumping in my neighborhood. And I, as a white woman, am not over-policed. So volunteer efforts are good, but they need to be followed up by concrete action by the city. So any volunteer effort should be followed up with talking to your legislators, talking to the mayor's office, talking to the aldermen, and saying that these are issues that are of concern to you, and these are issues that will decide how you cast your vote. And if enough people say that and think that and put that into action, then change will happen. But until it's an issue that is central to our lawmakers, where they realize that it's central to our voters and that getting our vote depends on that, no change will happen.
So thanks, Tara, first for reminding us that we always need to center the voices of people who are being impacted rather than riding in on our white horse. And also for the reminder that Band-Aid kind of fix-its are important, but that policy change is where the really long-term solutions can rest. Someone asked in the chat if reaching out to, for instance, members of the Board of Aldermen has any impact if one is not a city resident. Do you have insight on that?
I mean, unless you have some level of political power or making, I don't see, probably not, frankly. But it can't hurt to make a phone call.
Yeah.
It's
I
just a
weighed
phone
in
call.
on that as it relates to, this is Cheryl. I weighed in on that as it relates to this letter and the sign on, because I think that this is a regional problem and leadership is needed from the city. And I think if they see a letter with sign-ons from lots and lots of people that list their organizations, that list where they live, at least it helps elevate the issue as they come into the administration. We don't know what alder people were going to be assigned to certain committees at this point because there's a turnover. So that's why we're going to write to the president of the Board of Aldermen. But I think there's value in numbers and a diverse coalition. And so I'm going to encourage everyone to sign on to the letters that we're going to send you.
Thank you for that correction. En masse, yes, it makes a difference. People notice when their phones start ringing. People notice when their phones start ringing a lot, and people notice when their phones start ringing with repeated calls for the same thing. That gets noticed. So one person making a call alone without any others, it is what it is. But if lots of people do it, if lots of people care, then yes, masses have impact.
Nancy, I'm going to just mention one other thing, and we'll send this out in the follow-up, but we have in the chat from Dolores Sanchez, Sister Sanchez, that she's an organizer with MCU. Tara also just connected me with someone else with MCU, which is the Metropolitan Congregations United, that has an environmental justice team. So we're going to connect with them and find out how we can plug folks into that effort, and we'll include that in our follow-up as well. One more question, Nancy?
The one more was rather specific, but it wanted to know if these landlord-tenant regulations or policies are something that are set just at the local level, or is the state legislature or some other state body involved in those determinations? Tara?
Both. So some of our landlord-tenant laws, the majority of our landlord-tenant laws are at the state level. The fact that we don't have a statutory warranty of habitability that says the house that you rent has to be habitable. You have to be able to live in it safely. We don't have a statute that says that. The sort of litigation system that's set up that makes it nearly impossible for a tenant to withhold rent and make repairs on their own apartment when the situations are untenable. Things like that are set at the state level. But when you look at the actual codes, whether mold is an issue that a landlord is legally required to fix, what the energy standards are, things like that, that's set at the local level at the Board of Aldermen. So it really is a two-pronged approach. You have to look at it from both sides, and there's improvements that need to be made on both sides.
Thanks. I feel like we're at the end of our time frame here.
Nancy, there's just one other thing. I'm sorry to keep interrupting you. One of our participants today, Harvey Cantor, who is a retired doctor, has indicated he'd like to say a few things, and I'd be happy to hear from him. I just wanted to make sure our speakers got their questions in. So, and if people are signing off, again, you'll be getting a follow-up, but Harvey, please go ahead.
I'll try to be brief. Thank you very much for a very interesting program. I will say, as a Cardinal Glennon Children's Hospital physician for over a half a century, we were aware of these problems, and we are aware of these problems. That is to say, of lead poisoning of undernutrition of our children, which hasn't been mentioned, but its permanent effect on IQ, and the fact that schools, their lead, their pipes are still lead in some portions of our St. Louis public schools. These things have been known, and I will just say that it seems to me that when some of our the parents of affected children perhaps consider going to an attorney who specializes in lead poisoning. I have no one in mind, because we're not going to be able to get this through legislation, it seems, because it's so very expensive to address these very, very terrible and serious problems, that we need to find a way to incentivize our nation, and particularly our St. Louis regional nation, to wake up and address this terrible discriminatory environmental problem that afflicts our children, our African American and other children who live in those regions. And we must do this, it seems to me, very quickly. And perhaps the way to do this is by, like when doctors first began to be sued, we improved our behavior, and I think perhaps that would lead to some improvement. But that, I'm sorry for the length of that comment, but I think it's very, very important.
Thank you so much, Harvey, for sharing that. And obviously, you bring a whole additional perspective to the issue, and it's very much appreciated. We also appreciate all of you for joining us today. Look for your follow-up email with more about action items, including that important letter to sign on to. And we hope to see you again next month for that presentation.